So our final session today will feature a panel discussion focused on the challenges of providing health care in rural areas and the innovative ways that our local providers are overcoming all those challenges. I'm excited to let you meet the panel. I'm going to ask them to introduce themselves, and we're going to start with Don McBride.
I'm the CEO for Access Family Care. We're a federally qualified community health center located in 6 counties here in Missouri. We have integrated primary medical care, dental, and behavioral health services, and pharmacy.
Hawaii and hello, my name is Linda Davis. I'm a 5th-generation descendant of George and Minnie Cold Springs Red Eagle. I'm of Bear Clan. Currently, I'm serving my 2nd term as an elected official of the Quapaw Nation Business Committee. I am also serving on the governing board of the Northeastern Tribal Health System. It's it's tribally owned and operated, and it's an ambulatory clinic located in northeastern Oklahoma, and it primarily serves the American Indian and Alaska Native population. And just thank you all for allowing me to be here today, and thank you all for being in attendance.
I'm Sean Gaheen. I am the nurse manager at Cox-Barton County Hospital in Lamar, Missouri. I manage the inpatient med-surg and the emergency department. We're a 25-bed critical access hospital, and we're level 3 stroke certified. We do quite a bit of work there. We've been expanding services regularly, trying to ensure that we can keep as many patients as we can close to home in our community of about 12,000 people for the entire county, so we're pretty rural.
Hello, I'm Renee Denton. I'm the CEO for Rural Hospitals for Freeman Health System. We have a 25-bed critical access hospital in Neosho, Missouri. We have 2 rural health clinics that we operate down in the southern region. We have a 10-bed acute care hospital that we've just opened over on the Kansas side in Fort Scott, Kansas. And we have a fairly robust school telemedicine program where we are trying to impact the number of school days missed due to minor illnesses, trying to keep children healthy and in school.
Hello, everyone. Thanks for having me. My name is Dave Smith. I am the administrator at Mercy Hospital in Pittsburgh. Mercy Pittsburgh is one of the hospitals in the Joplin community, so Joplin, Mercy, Carthage, Galena, Columbus, and myself. I started my healthcare career in the late 1900s in Illinois in rural healthcare. So I've been with some pretty large 120-bed rural health facilities to 44-bed rural health facilities to critical access hospitals, and now we're over in Kansas with an 80-bed. So we could talk a long time about all the differences in those, but I'm glad to be here and can kind of talk a little bit about rural healthcare and where we've been and where it's going.
All right, panelists. I'm going to ask the question, and the panelists are just going to jump in if they have a great answer they want to provide us. So this question is about access and equity. What are the most pressing barriers to healthcare access in rural communities today, and how can we address them sustainably?
Okay, so for me, I view that question kind of in multiple phases. The impact to patients specifically, as many of you, I'm sure, recognize, in rural communities, they face barriers with transportation, with the distance that they have to travel to make it to a healthcare provider. They have socioeconomic challenges. Many times, our rural community citizens are trying to make a choice between obtaining their medications and putting food on their table, quite frankly. And that does happen, I think, a lot more frequently than we recognize. Some of the other barriers that they face, there's multiple cultural challenges that they face. They have limited access to healthcare and healthcare specialists. So when we have individuals who are perhaps rural citizens, let's utilize a farmer just as an example. A farmer may be out on his farm and he may be having some chest pain. And if there's not immediate access to health care, that farmer very likely will choose to continue working. They're going to put their health care at the very bottom of the list out of necessity, but also because they have the barriers of trying to make it to the care that they need. So I think as we're thinking about some of the challenges that face our rural citizens, we have to really remove ourselves from Joplin, Missouri, and we have to plant ourselves down in some of the most rural communities to truly understand all of the challenges that they face to receive the care that they need each and every day. Some of the community members that I interact with, truly preventative medicine is not something that they consider. Again, just because it is such a challenge for them to make it to that provider's office to have the testing that they need to try to prevent those disease processes that otherwise could very well be managed. So those are some of the top things that I see as challenges.
I would add one more, and this is more recent, affordability. So that's become an issue, especially this year when Congress failed to pass the subsidies for the marketplace insurances. There were a lot of people, especially in Berry County, that signed up for that, and they were very happy with it. And I'll give you a couple examples of folks that I heard. One person in the Aurora area was paying $220 a month for their health insurance coverage. When the subsidies went away, it went up to $800. So he's without insurance now. We're seeing the numbers drop and in our patient base coming to our clinics, especially in Cassville. So that's going to be a big issue moving forward. Some of the data I've seen, the failure to pass the subsidies has increased the uninsured by 21% in the nation. That's something significant and to be concerned about.
Great, thank you, panelists. We have some questions being thrown to you, and the monitor over here is where you can actually see those, but I'll read them to you. So the one that has the top votes at this point is, do you have any initiatives in mind to increase pediatric vaccination rates in the area?
We have vaccine, we're in the program Vaccines for Children. It is a concern for us. Education, we have to do that all the time. And we have to find the best ways to communicate the importance of that. And I think initially it's going to take some time to get those back up. But it's always been a struggle. Seems like it's more now than it ever has been before.
Probably going back to the pandemic and the COVID era and all of the mandates around vaccines at that time probably heightened the awareness of vaccines and made some parents a little bit more concerned maybe than previous. It was very much being talked about, as everyone recalls. And so I do agree with you, Don. I think the best strategy that we have is doing our very best to try to continue to educate parents and to keep them informed about the risks that are associated with that. And then, of course, it is up to every individual to choose whether or not they want to take that risk or not.
You know, at one time in, as far as the state of Oklahoma, they had what they called, I think it was called the Caravan program, where they would actually send, well, prior to that, they would send home slips with the students, and then if the parents signed off, then the Caravan would come to the schools and do those vaccinations to help alleviate some of the stress and financial burden on the parents to try to get their children to the schools. And I do know that NTHS, Northeastern Tribal Health System, our pediatric department does an amazing job with sending out reminders, and then also we are blessed to have transporters that will go out and help bring those families in that can't afford, or don't have a means, do not have reliable transportation, and help bring them in to help keep those numbers up, to keep our babies vaccinated and our children.
I think that's great. And we might not have an answer to every question that is coming to us from the audience, but, some of these questions will serve as opportunities for us to plan for the future and indicate where the gaps might be, and maybe that's one of those gaps. One of the questions that's gotten 14 votes is, are we seeing an increase in the number of providers staying locally now that we have an established medical and dental school in Joplin?
So we are extremely fortunate to have both the medical and the dental school here in our communities. And the studies will show you that providers going through the residency program, well over 50% of those individuals, thank you, will stay in the communities where they do their residency. And so I think that having those schools right here located in our hometown is definitely having an impact. I can speak specifically for Freeman. I know that with our family medicine program, we graduated our first inaugural group last year, and we actually retained 3 of those 5. And so I do think we are going to continue to see that benefit, which truly was one of the motivators behind bringing the school here, is trying to make sure that we are developing our own pipeline and doing everything we can to try to not only educate, but to allow those individuals to work in the communities that they will serve. Because once they begin working there, they develop those connections. Every provider wants to be able to fully help their patients. And if they don't have the resources or the specialty connections to be able to do that, then that patient's going to circle right back into their clinic just in a few days. So I think that those relationships and training those residents and helping them establish with those specialists and getting those collaborations going is absolutely critical, and I think we're going to see the benefit from it. I know we did last year.
So that's a great question, all 14 of you, because we talk a lot about recruitment. I've been recruiting from communities from 3,000 people to now into Pittsburgh, which is 20,000. And the discussion we always have is, to be able to recruit into those rural communities, you either have to be born there and know the community itself, or gone to college or school there. So it helps to have this university, it helps to have Pitt State, because those folks get exposure to the community. Nobody in residency in New York wakes up and says, oh, I think I want to work in Pittsburgh, Kansas when I'm done. They really have to come see the community, fall in love with the people that are there, or family members there. So yes, it's important to have residency programs. We have one as well for primary care in Pittsburgh, because then those students spend 3 years there. The spouses of those residents get established, the kids get established in the school system, and they most likely will stay in that community to not disrupt the family.
We shouldn't underestimate the incredible part that MSSU and the other schools and universities play in that, the Yours to Lose program, attracting those medical students to come here to do that. So it truly takes a village, and it's not unnoticed. We need to make sure that we're working together collaboratively, all groups, education, medicine, communities.
Great. So we have a question that's gotten quite a few upvotes. How does your organization facilitate clinical opportunities for students that will help us to sustain rural healthcare workers?
Cox Health, and we have a pretty robust system in place for students. We have an externship program that you can do while you're still finishing your program, and that kind of, they developed it this year to allow you to go to any department. Every department in our system actually goes into a pool that you can pick wherever you want to go, and you can go and shadow there, you can learn there, and from there then we have a a great graduate nurse residency program that is developed to provide additional education in your first 13 weeks and to be able to get additional orientation so that you can be prepared and ready whenever you're getting off orientation to take care of patients. It's pretty fantastic, really. I wish we had something like that whenever I was first starting.
Medical officer, he has his feet, 1 foot at the University Medical School and 1 foot in Access Family Care. So he's done a lot to help bring in students to tour and to shadow in all phases of our organization, even pharmacy, and they learn a lot with that. We also have a medical assistant, actually a school, on-the-job training, but also it's a school, certified school that they can take and go through. So, and we never turn down anybody. We have lots of agreements with universities and schools all over the place, and we love having students come through. We feel like we give them a great experience and they get to see things they normally wouldn't see in many other areas. So it's very important as far as recruiting is concerned. You got to start as soon as you can and keep it going. That's for sure.
And I think that question actually speaks to kind of the larger recruitment and retention efforts and building your own pipelines, especially in rural communities. At Freeman, and I know there's many good programs, so I can only speak to what we're doing. But at Freeman, we have an unlicensed assistance program, which allows individuals to come and actually do their didactics, do their clinical hours, and then they can set for their CMA at the end of that. We have a registered medical assistance program that we actually work with Crowder College collaboratively to train those individuals. We have a surgical scrub technical program where we're trying to allow people to go into different fields that they maybe are interested in. So we are always looking for opportunities to get students engaged at a very early age. We work with Neosho schools on their New Caps program, where we allow the juniors and seniors to come in and actually spend some time within the hospital. We have some medical explorer programs. So my message for the whole thing is early engagement of those students when they are in high school, and that exposure, and then having these types of programs for them to come into, to get their foot into the door within the medical career. And then they may find that they don't want to go into the caregiving portion at all, but it exposes them to the other elements of healthcare in IT, in facilities, in nutrition. So it really gives them a well-rounded exposure to be able to see not only what they would like to do, but to learn what they don't want to do.
So we similarly have nursing clinicals at our place and have a program through Mercy where you can do job shadowing. And I'm looking at some parents out there. I have 3 children. They started college with this major and they ended college with something that was completely different. Having the ability to shadow some of those real life job experiences was helped change some minds and change professions. I have one in particular student I've worked with that wants to go in endocrinology, is a junior in her medical studies, hooked her up with an endocrinologist, and now she's more passionate about that career than she was before she had that experience. So those are real important things. It's not necessarily clinicals, but you need to go see what you like to do. If you think you want to be a nurse and you can't stand blood, you need to go through surgery and put your hood on and take a look at that to see if you can do those types of things. Same with other professions, but the more we can do, all of us together, to get exposure in grade school and in high school, so kids realize that there's more to hospitals and doctors and nurses. There's back office work. There's all kinds of other positions. There's lab and diagnostic imaging and physical therapy. We could actually manage about 10 physical therapy students in our community because there's such a high need in this area. We just need to find someone to partner with. So it's really important to get students interested, because as that population gets smaller and smaller, they have a whole lot different careers to look at. Computer programming, when I started, wasn't a career at that point. They just had these big green boxes you could type some things into, And now, we can talk AI all you want to, but that wasn't something when we were younger, and now they're getting younger and younger students who are more interested. So the more we can get exposure to at any age, the better off we're going to be in healthcare.
I think many of us also qualify for loan forgiveness programs, which isn't as important to a student, but certainly is important once that student graduates and gets a job. A lot of scholarship programs across the panelists here. So we're going to go to another question. What are you doing to help with staffing issues with our hospitals? CSP is being removed and staff is leaving for competitors and more pay.
I'm Vicki. Could I answer the next question while someone is waiting to respond?
Absolutely, you can. Do any of you plan on making a mobile care unit to reach those that don't want to leave their homes to see a doctor due to work or ability?
Thank you. I can talk to you from a tribal perspective and what Quapaw Nation has established. We currently have a mobile integrated health program, and it is staffed with a community paramedic along with a community health representative, and she is an EMT. And these individuals go into the homes of our patients, and they are able to, it's patient-centered with health promotion, disease prevention, offering those services. And again, if there's a situation where they need transport, they can transport them. If there's mobility issues, then they also have the availability of Quapaw Nation Fire and EMS, and we can send out an ambulance to them. But we are, I can't really disclose a whole lot because I don't know a whole lot, but we are also getting ready to have a meeting with a Oklahoma academic, well, how would I want to say this after I've kind of let this out? Anyhow, we're in the process of wanting to be able to do more with telehealth and telemedicine. But currently at the moment, we do have mobile integrated health that we do go into the homes. So.
Thank you, that's awesome. I think there are other panelists up here who can talk to mobile as well. So yesterday, Ozark Center, we had a press conference. We announced the arrival of our mobile behavioral health unit. It's fully equipped for taking out on the road. It's less about going to people's homes. It's 39.5-foot recreational vehicle, and most of these mobile units are quite large. But it's more about thinking about it from a perspective of if you live south of Southwest City, just driving, and you're a single mom trying to get kids out of school to go to therapy and driving to Pineville, it's a distance, and it's costing you time at work, and it could cost you your job. So the mobile vehicle will go and park somewhere south of Southwest City, so you're only a few miles from it, because that makes a huge difference in your life. I know Dawn can speak to mobile units as well.
Yeah, not to brag. Not to brag a bit, but we have 4. We have 2 behavioral health units. We have 1 dental and then a medical, and most of them go to schools. And that really makes dental care especially more accessible, and parents don't have to worry about taking off work to make sure their kids get to a dental clinic. And behavioral health is just a big deal. Schools, we do some counseling in the schools, and then we have some mobile units as well. Play therapy for children. That's just a big, important realm right now. So it definitely doing that. And I think as we speak more towards the in-home services, our medical director one day just asked all our providers in one of their meetings, okay, folks, you all know rural healthcare better than anybody. You do it every day. What do we need? What needs to happen for this rural health transformation that we're looking at? And just some of the things that they said was just spot on. And a lot of it did deal with finding ways to take care of patients at home, whether that be monitoring devices. And I know there's a lot of implications with that, with internet and accessibility and those kinds of things. But even maybe having folks go and do labs in their homes, there's things that we can do as long as the cost coverage is taken is considered for that. But if we really want to focus on really taking care of rural folks, we're going to have to meet them where they are. And that's it.
So with Cox Health, and we actually are leaning into the advanced practice paramedics. They go to homes a lot. That's actually a resource that's used with a lot of EMS services. There's a lot of community paramedicing that's going on with Cox Health, and they actually have telehealth built in. They will go to people's homes, evaluate their homes, especially your high-risk and chronic disease patients, and set them up for success. Try to go over their medications, help them take vital signs, set them up with telehealth visits with providers to ensure that they can get that access that they need, because a lot of these people, they can't make it to their appointments, or their specialist is in a whole other town because, you know, small towns don't have every specialist. So they really try to just set everybody up for success. And that's really it.
I'm going to jump back and try to tackle the tough question that.
All right, do that.
So I'm not sure that everybody in the room is aware, but we all work at different facilities. And so competition is going to be something that exists no matter where we are at. I think, and this truly is a Renee thinks, okay? I think that the answer to that question is for the leaders to work together collaboratively and make sure within our organizations that we are developing cultures where employees enjoy coming to work, they enjoy the people that they work with, they feel like they have the tools that they need to do their job well, and they feel like they have the support of the leadership staff that works with them. There are 1.5 million, I think is what was in our presentation, residents in Missouri. There are thousands and thousands of patients. There are not thousands and thousands of specialty staff members. And so in my opinion, and in my practice in the past, I would try to create that culture where my staff wanted to be there, and they felt valued, they felt appreciated, and not putting programs, don't create programs, develop a culture of respect, a culture of appreciation. And I think that as we continue to battle our short number of workers in this health field, I think that we just each have to do everything we can to make our organizations and our workplaces the very best place, not only to work, but the best places to provide care to our customers.
So I'm going to jump right on that and talk about, there's a lot of you who are probably going into your healthcare career, just starting your career. You really need to look at the culture of an organization. Some places are going to offer you $5 more an hour and $10,000 sign-on bonuses. There's a reason there's such a large sign-on bonus in some of those places, because their turnover rates are so high, because you get in, new folks get in there, and the culture isn't developed the way she spoke about it, where you feel like you have a voice, you feel that you're valued as an employee, you feel like you love getting up every morning and going to work, and you look at me like, what are you talking about? When you get to that place, you'll feel it. It's a great place to go. Spent 5 years in Wisconsin at a critical access hospital that was in a town of 3,000 people. That turnover rates were 80%, because there was a University of Wisconsin hospital close enough that we'd have students, we'd train them, and in a year they were gone and in a different place. Spent 5 years going from 80% turnover rate to less than 2, because we really worked on developing a culture where they loved working there. They were heard. They saw administration. They got to talk to their leaders. The number one reason people leave their job is because of relationships with their one-up, their leader. It's not money. Money's probably 3 or 4th if you look at all the studies. It's truly that where you work, because you're going to spend more time where you work than you are at home, than you are with your family, than you are anywhere else. So you really have to find that place where that culture exists, that you feel respected and you feel like you belong. I believe, excuse me, I believe my role is to take care of the people who take care of the people who take care of patients. Because if our people love working there, they're going to provide 100% outstanding care to their patients. And that's the best marketing you can get, is patients telling other people in your community, you got to go to that place because they provide great care. And the way to do that is for us to be able to create that culture where you feel you belong and you want to be there.
Excellent answer. Yeah, I agree, Don. So the next question, with a lot of votes, I think I would paraphrase that question to say, keeping in line with culture, what do your organizations do to create a culture that's safe and supportive, yet educational for nursing students?
Still thinking a little bit on how to word it.
I can jump in and start so you guys can think a little bit. So we're really pushing for a just culture in our organization, and a just culture is something where we want to make sure that you're comfortable making mistakes and you're comfortable reporting those mistakes. We have what we call a good catch, which is somebody finding something before it gets to a patient that helps prevent a bad outcome, just for an example. And if you do that, we honor you for the fact that you said, oop, I made a mistake, but I caught it before somebody got to it. You know, you're in the Pyxis system and the wrong meds are in the wrong drawer, and you grab that med and you look at it and go, that's not what's supposed to be in there, and you contact pharmacy and they flip-flop it. That's an example of a good catch. So those creating that culture where it's non-punitive, that's the just culture, where you feel comfortable asking those questions, where you're able to learn how to get better by making those mistakes, as long as it's not harming anybody else. And then having that strong mentor. You have to have that person when you're a nursing student, you're a new employee, that you can go to and say, I don't know what he's talking about. Can you walk me through this? And feel comfortable being vulnerable with them so you can learn and get better. Because the only way you're going to learn, as you know, is you got to make mistakes and you got to ask questions. But you have to have an environment that allows for new people to do both and then advance their career as well. That's how you build good leaders. Ask those questions, make mistakes, and you'll get there eventually.
He's good with words.
He is very good with words.
I'll sum it up by, I echo that.
That's awesome. Okay, we're going to go to the next question. How does your system actively secure employment of bilingual employees, and how are they compensated as having an additional professional skill set? Or maybe not, I think the question should be, is being bilingual an additional skill set? And is it recognized that way in terms of compensation?
I definitely consider it an additional skill set, and we do compensate for that skill. So they're in our clinics, because we're a federally qualified health center by law, all of our employees have to be culturally competent, and you all understand the implications with understanding or being aware of different cultures and how people receive health care in their culture. And that's so important. And language is so, so important. So our bilingual staff are very important to everything that we do. And for the languages that we don't have staff speaking, we have a subscription to, I call it an interpreter on a stick. So it's a tablet, and we have that arranged. And so, I mean, they can visually see the interpreter, and all the gestures and all of that is so important with language understanding. So it's an additional skill set, and it's very important to delivering good quality health care.
I'm going to agree and say what's something that's coming that's really cool, because we have interpreter on a stick too, but he's more on a roller man. AI is now developing, and we could talk about Epic all day long, but when you get to the place where you're a smart community, the AI will automatically interpret for patients. So if you have a patient in an inpatient bed and you're speaking to them, it runs through AI and it will automatically transfer for you, so there isn't the interpreter on a stick. So there's a whole lot of technology coming that's going to make healthcare better and make it easier for you as you start taking care of patients.
All right. Any recommendations for finding grants or educating legislators to continue, if only we knew, to continue funding our telehealth oral health services program at MSSU for rural schools. It's very specific.
I know our organization has reached out and we have tried to host some of our representatives and kind of share our view of how that looks. However, what that does whenever they get back to Capitol Hill is a whole different conversation that we just won't probably touch here. I know that probably most organizations are reaching out and trying to host their local representatives to ensure these conversations are happening so that we can try to look after our communities the best we can.
I think one way to set yourself apart when you're in a situation like this, which is cyclical. We have really great years where funding doesn't touch education or behavioral health or healthcare, and we have difficult years. And frankly, we have difficult years ahead for healthcare and all the associated things. And I don't think education is probably faring much better, but I think there are ways to maybe make yourself stand out a little bit. Everyone's gonna be asking for the money they lost or for the money they're going to lose. And I think the way you make yourself stand out is to show legislators that what it is you want them to fund is gonna have a savings on the back end, because it's all about money when it comes to these kind of discussions. So I think making sure that your legislators are aware of how you intend to have that program or that service save on the back end is really critical, and they are a lot more responsive to that than excuse me, than just excuse me, than meet and greets. That's I get choked up when I have to talk about politics. All right. Next question is, given workforce shortages in rural healthcare, what specific incentives or retention plans do you think could work to help build a healthier rural community?
Recruitment and retention that Indian Health Service offers is like relocation cost, and then housing, or the housing to include relocation cost. That's an example of one of the things. Then also retention. I don't remember exactly what the question is, it rolled, so I apologize. But then one of the other things for retention is you can apply, if you are awarded and you become a recipient of the Indian Health Service scholarship for, say, nursing, medical, or what have you, they do a 2-for-1 for every year they put you through school, then you pay back as 2 years employment with them. And I'm sure that probably some of the hospitals here have those similar type of contractual agreements with retention and recruitment.
I know in behavioral health we will pay up to a certain amount toward a master's program, and then the person agrees to work for us for a certain amount of time. So those are very popular incentives.
We have some scholarships, some not only nursing scholarships, but other scholarships that we try to encourage people to apply for to continue to grow in their field. And I think that making certain that that people know the avenues to access that information is very important as well. So I think we have to make sure that we're educating everyone on how and where to look for that type of funding, and not necessarily grants, but those types of scholarships.
And I think we'd be remiss in not taking the opportunity to go back to a previous question, which says, you know, incentives are great, but culture's better. Absolutely. So building the culture is really important.
So I think we all have the same incentives somewhere, somehow, for most of our folks. We're really focused on your day-to-day job, your efficiencies. And how many of you know, if I said Epic, you'd know what tool that is? Electronic medical record? Okay, so Epic itself offers a whole lot of efficiencies. It's just getting in that training and having you be able to come better and better at it. We at Mercy, if you're for physician burnout, which is the biggest piece, If you remember back in the day when you went to see the doctor and they put the computer on their lap and they didn't make eye contact because all they had to do was type, to now there's a app on your phone called DAX for Epic where they'll put it down, and as you speak to the physician, it pulls the data and drops it in each space in that medical record where it's supposed to be. So doctors who are working 3 hours a night typing notes now work 45 minutes reading to make sure that information is accurate where it's supposed to be. We just introduced, well, we will introduce that as far as Mercy as a system, and we're 50 hospitals in the 4-state area. We're going to introduce that on the inpatient side now for both physicians and nurses. So when you go into a room with a nurse, you can speak with the patient, not have to do all the documentation on your cow or wow, whatever you call it in your organization. And it will pull that into the document for you, so it's a matter of reading. And you say, what difference does that make? Ask a nurse who's seeing 8 patients or more, or somebody in the ED, how much better efficiencies can be if I didn't have to sit and type or click. So now those types of things with AI-enhanced issues in Epic are coming to make efficiencies better. That helps retain your current workforce, both physicians, who, if you talk to some of those folks, they get really burnt out with managing data instead of managing a patient, and a lot of the front caregivers as well. So as they continue to develop that, getting better efficiencies, it helps with retaining staff.
All right, thank you, panelists. How does your organization balance a patient's ability to pay with the care they need? Great question.
I would have to just offer up this information. Again, I speak to you all through Indian Health Service and tribally operated facilities. We do not have out-of-pocket for those that present to the to be seen. Now, one of the things too, addressing the purchase referred care, that is a contractual service that is utilized for services that we do not have per se in our clinics or in our hospitals. So that is another area that there's certain criteria to have to be eligible for that, as well as one is the residency of where you live in that service area, service delivery area, and then the other is emergent, urgent, necessary, and then you also get into reimbursements through Medicare, Medicaid, VA, and those sort of things. So my take on this is a little bit different from what some of the others on the panel have.
And for instance, like at Cox Health, and I'm sure the other organizations have something similar, is we have a Cox Health Foundation. So if they are needing services that are outside of like the EMTALA regulated ones where we have to provide care, then they can provide some information on a form and submit it, and a lot of times then people under a certain income bracket will get their care taken care of by foundations so that they can make sure to get that done.
And we have financial assistance programs, and so in addition to that, we have financial navigators, and so there are many patients and customers who not only are underinsured, but perhaps they have no insurance, and perhaps they don't really even know what steps to take to try to apply for Medicaid or to take the steps that they need to apply for coverage. And so we have navigators who work with them to actually they can act as their proxy if the patient gives them permission to do that, and assist them in filling out all of those forms for that financial assistance to see what they may be eligible for coverage-wise, and if they're not, then we work with them on the back end to create some sort of a payment plan that would work for them, and then ultimately in the end, we are a not-for-profit organization, and there is much care that is delivered for free, quite frankly. So we take care of the patients. That's what's most important to us, and that's what we keep in the forefront.
So we're a Medicaid provider. We do have Medicare also. We're in network with most of the area insurances. We also have a federal grant that provides a sliding fee discount based on total household income, number of people living in a household. So it's based on the federal poverty guidelines. So that's been very helpful. We also set up patient accounts. So by law, we cannot turn away anybody based on the way they choose to pay. So we find a way to make sure that it happens.
We have charity care as well, very similar. And one of the neat things, and I hate to keep pushing Epic, is if a patient comes in any of our facilities and let's say they don't have insurance because they don't think they qualify for, let's say, charity care or Medicaid, Epic AI will go pull all that information, and if they do, we'll give our counselors the information, and we'll get on the floor and make sure they can get enrolled in whatever insurance they fit best with. But if they don't have any, we provide that care anyway.
Great. I think I skipped one. So I'm going to ask you this. I'm not sure that what most of the panelists are experts in this arena, but we'll give it a shot. How can we trust AI to properly translate important medical information? And how are you safeguarding AI from selling this personal information to companies?
At this point, I would defer to our IT specialists, and I do know that that we have a very robust security program in place. We have all types of authenticators and steps that have to be taken to take every step that we possibly can to secure that information. I think we all know that there's some very intelligent technological persons out there that may not have the best intentions. And so all we can do as an organization is do everything we possibly can to put those security firewalls in place to try to protect that information. And then, of course, within the facility, practicing all of the things regarding HIPAA and making certain that we're doing what we need to do at the individual level to make sure that we're not exposing any patient health information to anyone other than the patient or their authorized agent.
Not touching that one, huh?
But we don't sell data. If some of you remember back in the day, they were going to put chips in your wrists and put all your medical data on there, so you could go in and scan the medical data. And people said, "I'm not doing that because everybody will follow me around, know what I'm doing." Guess what you all have in your pocket right now, where they can follow you around and know exactly where you're going and what you're doing. Same kind of concept. So if you don't think AI is alive and well, you need to get rid of any electronic device you have, because anything and everything you do is being monitored, tracked, and trying to sell you different products based on that.
All right. Are there discussions about long-term health prevention strategies, food choices, increased activity, et cetera, in our communities so that we can have a healthier future?
So one of the things that I'm really excited about is our Rural Health Transformation Program. I'm sure that all are aware that the federal government has committed $50 billion to this project. Here in Missouri for year one, that equates to about $216 million. And I think one of the things that I'm most excited about is the TORCH program that Missouri is setting up is developed as clinical hubs, and the entire purpose is to bring all of those elements, all of those important spheres to the table so that we are all collectively working on the future state of health for our state. I think one thing to keep in mind is we often isolate our thoughts to medical conditions, but there is so much more that impacts a patient's medical condition. We have the physical, we have the behavioral, we have the food insecurities, we have the financial strain. So it truly is a holistic approach. And so in response to that question, I know that there is a lot of work being done right now to evaluate and to bring those hubs together so that we are developing programs, we are working collectively as a group to make sure that Missouri is a healthier place to live. We've got the bike trails, we've got the activities that go on throughout. And so I'm really looking forward to see where this leads over the next 5 years. And I think that this is probably, in my opinion, one of the greatest efforts I've seen in a very long time to look at individuals as a whole and make sure that we're addressing everything that impacts their overall health and not just the physical medical condition.
All right. So we're going to do 2 more questions, I think, given the time of day. Do you have any plans to work directly with the programs in the new health simulation building? I believe they're probably referring to the new Roy Blunt building that's right across the street.
Yes. Yes. Yes, can we come and play? Actually, I think that absolutely will provide wonderful opportunities. And if MSSU is willing to share that with our staff, I am sure that we would absolutely love that. Would give lots of learning opportunities. There's things that once you begin working in the medical field, they're not things that you do on a daily basis. And if you don't do them frequently, then you can't ever truly become expert at it. So having the opportunity to perform those procedures in a simulated environment would be wonderful training as we continue to work together collaboratively.
Truly an amazing facility to have right here in Joplin. So we're going to do one more question and then a final question for the panel. What steps are providers taking to educate patients on the link between oral and systemic health, and are you coordinating hospital and dental care?
I will say we live in that realm, so we're integrated. So we have medical and dental care. We have it crossing over. I think one thing, and this is going to sound bizarre to a lot of people, but I think we need to have one insurance. We have dental insurance, we have medical insurance. I think if we could do something different with that, people would begin to see all of it see us all as one person. But our head is not disattached from our body, our teeth are not, they're all part of us, it's all one body. I think that will help us, but we definitely do that in care. We have, when a patient comes into our dental clinic, their vitals, we take their vitals. If they have high blood pressure consistently, we won't see them. We're going to send them over to the medical side and get some attention. We've also had behavioral health come over and help with some of our dental patients who have major fear for dental care, which a lot of people do.
It's real.
It is real. So we're making it happen at Access Family Care, Community Health Center.
We're fortunate that we are able to work with Dr. Barbara Miller on a daily basis. Dr. Barbara Miller is the medical program director for the Family Medicine Residency Program. And in Neosho, she actually has 2 residents each year that we receive who do a rural rotation down in Neosho. And I will tell you that I have observed and heard her talking with her residents about the importance of oral care. So I do believe that there is great emphasis, especially in the academic areas, being placed on the connection between oral and physical health, if you will. The other thing that we are doing right now is we joined with, we have a school telemedicine program, and we have approximately 10 school districts that participate in that. We're at about 56 different school locations. And we partnered with KCU last year to begin an oral program. So in each of our schools that participate, there is actually a telemedicine machine that's located right in the school nurse's office. And in those offices, they have an opportunity to do a telehealth visit or a clinical visit. That goes back to us making sure and trying to do our part to make sure that we're keeping students healthy and in school. But in 2 of our schools, we partnered with KCU, and we're actually doing pilot programs with them on oral health. And so we're trying to break into that arena and make sure that we are considering all avenues of conditions that lead to medical problems. And so hopefully in the next year or 2, I'll have some more information on that. But we are trying to work in that area as well.
In behavioral health, we've created some referral agreements with KCU Dental. So we send a lot of patients to KCU Dental who now have third-year students doing a lot more. So that's always a really great collaboration. The final question to the panel is this: what do you see trending on the horizon that could transform rural healthcare?
Yeah, AI, I mean, it's what's coming. Telehealth is kind of quintessential to the rural health setting, especially when it comes to those kind of more obscure specialties that we don't have a huge need for in our locations. However, the proximity to our rural locations is just far. So being able to utilize some of these telehealth and AI tools to help care for these patients near their home versus them having to drive to, Joplin. And Joplin doesn't even have every specialty, or they're not the definitive care for that case. They may have to go to Springfield, Kansas City, a major university hospital. So just being able to utilize those tools better, that's what's on the horizon.
And I would just like to go back to you mentioning drones earlier. There's one of the tribal nations in southern Oklahoma that as far as their health care, they are piloting delivery of medicine with drones already. So that's exciting. Yes.
So to jump on what he said about rural healthcare and specialty, if you can get the right tool, you'll be able to get virtual care, neurology, infectious disease, some of those specialties that you need to be able to take care of those patients in your community. It's going to be very difficult to recruit a neurologist to a small rural hospital. But if you have the right tool, you can get virtual care where patient comes into your ED and you're able to actually get an immediate consultation from a rural neurologist. And you all know stroke. Stroke is about time, right? Stroke damage is less with time. You can be able to order those tests in your building and treat that stroke patient in your building instead of stabilizing them and shipping to places like Joplin or Casey. So with us, it's the Epic tool that allows us to have most of those specialties out in the rural setting to be able to treat those patients in the communities that they're in. And then AI, hang on to your hats, folks, because it's so interesting, even on the back end and billing side, of how AI is all integrated into most of the stuff that we do. But it'll really, if we do it right, great efficiencies for providers, direct patient-facing folks, and then helping us all on the back end of things as well to keep the revenue cycle rolling so we can stay open and stay operational.
And I think the remote patient monitoring devices is going to be critical as well, because those are devices, again, that patients can wear at home. They don't have to come into the medical setting for us to check those things. And I think that is going to change our future very much as well, allowing us to really, truly get medical care and monitoring in those rural communities who otherwise have great difficulty making it in.
All right. Well, we thank you, panelists, for taking your time and being here this afternoon and answering the questions the audience has. So let's give them a round of applause, everybody. Well, thank you to all of you guys for being here at the 3rd Annual Willcoxon Innovation and Health Sciences Summit. We're really grateful that you are attending this year, and we're excited to announce the date for the 4th Annual Willcoxon Health Sciences Summit. It will be held on March 27th, or sorry, March 12th, 2027. So safe travels, everyone, and we look forward to seeing you next year on March 12th.